Imagine waking up, going to your medicine cabinet, and realizing the life-saving drug you rely on to prevent a heart attack or manage your diabetes is just gone, completely on global backorder. And why? Because it's suddenly become the internet's favorite rapid weight loss trend. It sounds crazy, but that is the startling reality we're facing right now. Welcome to the Medicine Diary. Today we're cutting through the noise. In this explainer, we're going to break down the absolute latest head-to-head clinical trial data, navigate the deeply complex ethics of these drug shortages, and give you the actionable, evidence-based facts you actually need to understand these powerful therapies. Let's get right into it. So we have to ask the big question. Is this global weight loss drug craze actually ethical? We really need to start with a critical look at the off-label use of diabetes medications like Semaglutide. Right now, there is an absolute explosion of non-diabetic patients seeking these drugs for rapid, cosmetic weight loss. And look, while doctors certainly have the legal ability to prescribe off-label, doing so indiscriminately during a massive supply crisis, that creates a profound ethical conundrum. It literally pits the desire for instant weight loss against the immediate survival needs of highly vulnerable patients. Medical authorities are sounding the alarm, warning that this indiscriminate off-label prescribing may actually compromise the fiduciary responsibility of the physician. But what does that mean for you? Well, it means this trend is driving severe worldwide shortages. High-risk type 2 diabetes patients, people who rely on these medications not just to tweak their blood sugar, but to actively prevent fatal cardiovascular events, are being left empty-handed. They're being forced to switch to less effective alternatives, which directly compromises their long-term health. Here's a crucial takeaway for our everyday health. A quick fix usually does more harm over the long term. Taking these medications purely for instant gratification without any sort of holistic plan totally ignores the true complexities of obesity and diabetes management. As both the American Diabetes Association and European guidelines explicitly stress, just throwing a drug at a metabolic issue without addressing the behavioral and psychological factors is a recipe for long-term failure. True autonomy in medicine means understanding that real, sustainable results take time. All right, let's pivot to the science and look at a side-by-side comparison of the two heavyweights in the incretin class. On one side, we have Semaglutide. You probably know it as Wegovy or Ozempic. This is a monoagonist. It solely targets the GLP-1 receptor to delay gastric emptying and suppress your appetite. But on the other side, we have Tirzepatide, known as Zepbound or Mounjaro. Tirzepatide is a dual agonist. It activates both the GIP and the GLP-1 receptors. This dual-action approach doesn't just suppress appetite, it fundamentally modifies how your body stores lipids and enhances your overall metabolic response. When we break down the clinical efficacy, the difference is honestly staggering. The top-line results from the SURMOUNT-5 head-to-head trial, which, by the way, is the very first trial to pit these two directly against each other in adults with obesity, are incredibly revealing. Over 72 weeks, Tirzepatide showed superior efficacy, driving an average weight loss of 20.2% compared to 13.7% for Semaglutide. To put that into perspective, Tirzepatide resulted in nearly 50% more relative weight loss. Plus, patients on Tirzepatide were twice as likely to hit a massive 25% total body weight reduction. But of course, these incredible results come with a physical toll. A staggering 44% of users experience nausea on Semaglutide, and Tirzepatide shares a very similar gastrointestinal side effect profile, which includes nausea, diarrhea, and vomiting. Remember how we said these drugs essentially freeze your gastric emptying process? Well, your body forcefully reacts to that sudden change. It's absolutely vital to note that these are not just magic, side effect-free injectables. The good news? These gastrointestinal side effects are typically transient. Take a look at this timeline. During weeks 1 to 4, as your doctor ramps up your dose, those symptoms are going to peak. But for the vast majority of patients, these side effects resolve completely within a 4 to 8 week adjustment window. In fact, fewer than 3% of patients in clinical trials actually stop taking the medication because of side effects. Knowing this timeline is absolutely crucial for managing your expectations and sticking with the therapy safely. Okay, moving away from weight loss for a second, let's look at another groundbreaking class of metabolic drugs, the SGLT2 inhibitors, specifically Farxiga and Jardiance. Now, these were originally designed to simply force the kidneys to excrete excess glucose through your urine, but they have radically evolved. Today, they are essential first-line therapies for heart failure and chronic kidney disease. They are fundamentally changing how we protect our most vital organs. So how do you and your doctor actually choose between them? It all comes down to your specific clinical profile, which matters immensely here. Take a look at this clinical decision framework. While both drugs are incredible, Farxiga offers superior FDA-approved protection for advanced chronic kidney disease. It's safely usable even when your eGFR, that's your kidney filtration rate, drops all the way down to 25. On the flip side, Jardiance is highly specific and uniquely FDA-approved for a condition called heart failure with preserved ejection fraction, or HFpEF. Basically, that means it works even when your heart muscle pumps normally, but is too stiff to fill properly. You've got to match the specific drug to your exact cardiac and renal numbers. Now, beyond weight loss and heart failure, we absolutely must talk about a true legacy diabetes drug, Metformin. It's been around for decades, but right now, it's at the center of one of the most exciting mysteries in modern medicine. Researchers have actually noticed that diabetics taking Metformin often outlive non-diabetics who aren't taking it. This observation sparked the massive TAME trial, Targeting Aging with Metformin, to see if this cheap daily pill actually possesses genuine biological anti-aging properties for the general public. You see, Metformin doesn't just lower blood sugar. It acts at the absolute deepest cellular level. It activates an energy-sensing enzyme called AMPK, and it indirectly inhibits the mTOR pathway. By doing this, it essentially tricks your body into thinking it's fasting, which mimics the biological effects of caloric restriction. It reduces oxidative stress, it clears out old senescent cells, and it fundamentally alters the biology of aging. The goal isn't just to increase your lifespan, but your health span, those crucial years you live totally free from chronic disease. Ultimately, no medication, whether we're talking about Tirzepatide, Jardiance, or Metformin, is a magic bullet. True metabolic health requires a multidisciplinary, holistic approach. You need an individualized assessment that goes way beyond a simple BMI chart to look at your unique lipid and metabolic markers. You need tailored diet plans, guided physical activity, and crucially, psychological support to address the behavioral roots of your eating and lifestyle habits. Medicine is just the catalyst, right? Your daily habits are the engine. We really hope this explainer has empowered you with the science and the clinical realities you need to navigate these incredible yet complex therapies safely. Knowledge truly is your best prescription. To stay informed with accurate health tips and medicine guidelines, make sure to subscribe to The Medicine Diary and share this video with your loved ones. Before you go, ask yourself, as these powerful drugs completely redefine human longevity and weight management, are we finally curing metabolic disease? Or are we just treating the symptoms of our modern environment? Think about it, and we'll see you next time.